The COHMIS leads recently updated our client release of information, or ROI. The changes we made were minimal, but we wanted to review them with you during this refresher training to flag what's changed, as well as reinforce the best practices associated with working with the folks we serve when they're deciding whether to provide consent to share information between COHMIS participating providers. When reviewing the COHMIS client release of information with the households you're working with, it's important to remind them that COHMIS is a statewide care coordination system, and our COHMIS client release of information is a statewide care coordination document. By using our COHMIS ROI across all COCs in Colorado, the folks we serve who provide consent to share their information via our ROI will not need to sign multiple ROIs when they move between regions. Completing this ROI with one COHMIS participating provider will cover sharing information between all COHMIS participating providers, specifically for care coordination purposes. We're trying to reduce the amount of paperwork folks have to complete in order to facilitate them receiving care and needed services from the providers who use our system. It's important to remember that each adult household member, meaning those who are 18 years of age or older, need to provide consent for our COHMIS ROI. For households that contain minor household members under the age of 18, their head of household can provide consent for them. Regardless of whether consent is or is not provided for these folks, the status of this consent must be documented in HMIS for each household member, with clients who do not provide consent having their profiles marked private to the agency creating them in the system. Let's break down each part of the updated COHMIS ROI. At the very top, you can tell it's the updated ROI because we have an updated logo in the top left-hand corner. And this also has some high-level information for the client, informing them that by signing this form, they're allowing COHMIS partner agencies to share their personal information, again, to coordinate housing and homelessness resources and related services on their behalf. We encourage you not just to hand this document off to the folks you're working with, but to review it with them and make sure if they have any questions, you're reviewing those with them. Up next, we review what COHMIS is, spelling out the acronym and explaining that it is overseen by the 4 continuum of care groups in Colorado, including Metro Denver, Pikes Peak, Northern Colorado, and Balance of State. We then explain who may share their information if they provide consent for ROI, including county human and social services agencies, nonprofit community groups, and other care coordination groups that they are either currently receiving services from or may receive services from in the future, directing them to our help desk at cohmis.zendesk.com, where they can always see an up-to-date list of COHMIS participating partner agencies. And while the help desk has our most up-to-date information about the current list of partner agencies, COHMIS is an ever-growing care coordination network. So calling out that looking at that list of participating agencies today, it might look different if you look at that list next week or the week after. All of those providers sign agency partnership agreements adhering to the policies and procedures and requirements of using HMIS for those care coordination purposes, but we do want to be transparent about our ever-growing and expanding care coordination network and the importance of directing folks to the help desk to always see that up-to-date list. We then explain how their information may be used if they provide consent for our ROI. And this is primarily for care coordination, for coordinating those housing and homelessness resources and related services on their behalf. We also do include language about how anonymous information that does not identify folks, may be used for research or evaluation purposes, which helps us increase funding opportunities to improve the performance and response of our homeless service system in Colorado. At the end of this section, we also clarify that both the continuum of care groups and the partner agencies must keep personal information confidential and follow all federal and state laws applying to their information. The next section reviews what information may be shared by providing consent, including identifying information like name or date of birth and social security number, as well as demographics like race and ethnicity, gender, and then contact information or previous or current addresses. Basic medical, mental health, substance use, and other daily living information, housing and program eligibility information. Really all these details that we're collecting through our intake paperwork, through the program enrollments that we complete. Providing consent through our ROI allows us to share that information between participating providers and coordinate care and services for the folks that we serve. This can also include photographs if folks are willing to have a profile picture in the system as well. We then try to underscore that the client understands that providing consent for our ROI, that the following statements are true. They have the right to know who has seen their information. They may see their information at any time and change it if it is wrong. And they may also cancel this consent at any time by filling out a revocation of consent form, which they can get from any partner agency. This revocation form is posted on our help desk, and we will go over that form in just a moment. We also have language indicating that they may file a complaint if they think their information has been misused. And if so, they can fill out our grievance form, which they can get from any partner agency and is also available on our help desk. And we'll go over that form as well in just a moment. We then try to clarify that clients are able to refuse to provide consent or share information between COHMIS participating providers and still retain the rights of access to the agency's services that they're presenting at. Clients do not have to provide consent to receive shelter or services that your agency provides. There are steps we need to complete in HMIS when this happens, marking profiles private to the agency creating the profile, but consent is a choice and client choice is at the forefront of this process. With that being said, we also have language that includes details about how if folks do refuse to share information or provide consent, there may be certain eligibility implications for programs or funding sources that require specific pieces of information about that person in order to serve them. I'm thinking specifically of instances like Department of Veteran Affairs funded projects. A person can't refuse to provide proof of their veteran status or their active duty status for some of those resources. So just kind of clarifying, you're able to refuse to provide consent or share whatever piece of information you don't feel comfortable to share, but there are eligibility implications for certain specific funding sources where those details are needed in order to be eligible to receive those services and programming. And rounding out this section, we call out that folks may have a copy of this form and that this consent form that we've obtained from folks expires 7 years after it is obtained. COHMIS policy is that our ROI is valid for 7 years. All of the sections we just reviewed are largely the same as they were in the previous version of the COHMIS ROI. The main tweaks that we made are at the bottom of the document, and they're about the line items for the folks who are providing consent and the details of the agency and staff members who are working with folks to complete these consent forms. The COHMIS ROI should be completed by every adult 18 years of age and older in the household that you're working with. These adult household members, or if applicable, guardians of dependent household members, should list both their printed name, signature, and date this consent was provided in the top left-hand side of this section if written consent is being obtained. On the right-hand side of this section, the printed name of all minor children under the age of 17 can be listed, or if applicable, the name of the dependents their guardian is signing on behalf of. The middle portion of this section includes details about the agency that's working with this household on this consent form, including both the agency name, the agency representative name or staff member, and the agency representative's signature of that staff member, as well as the date that this form was being worked on. So this is a section that we tweaked very slightly to provide better documentation about the person at the agency that was working with this household on this consent form. And at the very bottom of this section, we also added a section where staff can add their initials if verbal consent was obtained, which that happens if you're working with folks virtually or talking with them over the phone. If verbal consent is obtained, you can indicate with the staff initials at the agency that was working with this person that that verbal consent was obtained. We added this for better documentation purposes. And on the far right-hand side of this bottom section, we also have the initials for the client if they're declining to provide consent. again for documentation purposes. And then you'll also be able to see the updated ROI version, which right now is 2024 version 1.3, and we revised earlier this summer in July. The COHMIS client ROI can be accessed on our help desk at cohmis.zendesk.com, specifically within the Documents and Forms section of the help desk. After navigating to the Documents and Forms section of the help desk, you'll see a section at the very top called Client Forms. And by clicking on the FY 2024 New COHMIS Client Forms link, you'll then see our updated ROIs, our revocation request forms, and our grievance forms, all of which are available in English and in Spanish. A current list of COHMIS participating partner agencies can also be accessed by visiting our help desk, specifically by navigating to the Continuum of Care and Participating Agencies section. After navigating to the Continuum of Care and Participating Agencies page of the help desk, you'll see details about each continuum of care, and then links for the list of COHMIS participating agencies for that COC, and if applicable, a list of coordinated entry participating agencies for that COC, for the COCs that use our COHMIS ROI for coordinated entry purposes as well.